Thanks everyone for joining us. Today is February 10th, 2021. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center, and I'm an emergency physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly. It's a show about all aspects of healthcare and the aspects that matter to you most. You can submit questions on our Facebook Live page. We also have some questions that came in ahead of time from wellness@svhealthcare.org. And let me just start by saying this is our inaugural episode. We're very excited. We plan to bring you healthcare topics and a variety of guests each week through live stream and on other social media platforms, as well as in a podcast format that we hope to have ready within a few weeks. So you can listen live to us or you can listen on your own time. And let me just start off by saying I have a few goals. I have 5 goals for the show that I want to get out on this inaugural episode. The first is to motivate and inspire you as an individual, as well as the population in our community, to develop a continuous and enjoyable focus on overall health. The second is to deliver sort of an entertaining show that's relaxed and conversational in manner. A third, we want to break down complicated concepts in medicine and issues in healthcare that are really difficult to understand and bring it into a format that matters to us. What do we need to know and how can we use this to improve our own health? We want to bring you access to a wide variety of guests. We have a super guest today that I'll be introducing in a few minutes. And then we want to make continuous improvement based on your feedback. So you'll have the ability to send what you liked, what you didn't like, what you want to hear, and we will use all of that information to improve the show. So let me say that the title of our show today is So Much to Gain and Nothing to Lose. And by that, we're talking about vaccination in the COVID era, the COVID-19 vaccine that's here. Depending on your state, it is available to certain age groups and specific types of workers. There's a lot of information out there. It can be confusing. We'll go into some of the testing aspects, really all aspects of COVID-19 that are relevant today as we try to bring this pandemic to a close over the next, hopefully, 6 to 12 months. And we've written about the vaccine a lot. We've done a lot here at SVHC to promote the vaccine, to dispel the myths, to talk about testing, to educate the public. Most recently, we put a commentary in the Vermont Digger that you may want to check out that kind of explains why vaccination is important and what some of the myths and problems are that are circulating. And then as well, our website at svhealthcare.org has a lot of information on the not only the vaccines, but COVID-19. And then I have to give a plug to the state and to the local health department who've done an amazing job in putting information out there. If you just take a few minutes and go look, they have a great FAQs section, which are frequently asked questions. And I love them because I've had some of those questions myself. I can find the question and get the answer. My guest today is Megan Harrington. She is the District Director of the Vermont Department of Health, the Bennington District Office. Megan, welcome. We're so excited to have you.
I'm so excited to be here on this inaugural episode. Thank you for having me.
Absolutely. We're so excited. So a little bit about Megan. Megan relocated to Bennington from New Orleans to join the Vermont Department of Health, actually, in May of 2019. So coming up on 2 years here pretty soon. She earned her Master's of Public Health from Tulane University, the School of Public Health and Tropical Medicine in 2010. And in New Orleans, she completed her work. She was an infectious disease epidemiologist for the Louisiana Department of Health. And she has a real strong interest in food insecurity. So let me just start by asking something real quick, Megan. What is tropical medicine?
Tropical medicine, a lot of times focused on kind of diseases. You would see malaria, you would see mosquito-borne illnesses, parasites, fungal infections, things you'd often find due to poor water quality, mosquitoes, things like that. It was not an area I dove too deep into. That was a whole other group of kids who would do their internships in very tropical foreign places every summer. My concentration in school was actually in global health, but touched on tropical medicine. And I was really concentrated on refugees and displaced persons while I was in grad school. which also led me to food insecurity issues as well. So yeah, the tropical medicine kids were really cool though.
That is great. Are you finding much tropical medicine up in Bennington?
No, I would say the tick-borne illnesses feel relatable,
Right.
but definitely a different breed.
What brought you up to Vermont?
So I was in New Orleans for about 10 years. I went to Tulane for grad school, and I meant to leave. I did. I meant to leave New Orleans after grad school, but the city kind of got under my skin, and I ended up staying 12 years instead. I had gotten into the nonprofit sector in New Orleans, and I was very eager to get back into public health, and in a place that I felt would more reflect my values as a public health professional. And so Vermont really called to me in that way. On the national level, Vermont stands out for really progressive ideas and an equitable lens. And I really wanted to be a part of that culture.
That is fantastic. I have to say that when I speak with folks like yourself that have advanced degrees, doctors and nurses, they are attracted to Vermont because of the type of medicine and healthcare that we can provide in the state, and that's something to be really proud of.
Yeah, absolutely. It really, really spoke to me when I was looking.
I think a lot of people don't really know what like a local health department does these days. Can you just give us a little description?
Absolutely. So Vermont is unique in that we have a centralized public health system. So in some states, you might see county level health departments. So that health department almost functions as its own unique entity. Texas is a great example where they have a county level public health structure. So you have something like 130 different health departments operating in the state. Vermont's a little bit more coordinated in that we have 12 district offices, but we're all actually associated with the state public health system. So our responsibilities at the local level are executing local public health programming. So, and that looks unique in every community. What we do in Bennington will look different than Brattleboro and will look different than Newport. The sweet spot about the local office is that we can be really attuned to our community and really focus in on the issues and the people that are here, versus a statewide approach where you might get, recommendations that don't really fit what you're seeing in your community. So at our local level, we provide immunizations. We have a WIC office. It's one of our biggest public-facing operations, Women, Infant, and Children's Nutrition Program. We offer emergency preparedness services. We do our local epidemiology investigations pre-COVID. There were other diseases out there that we actually investigated into. We're also really big into the collaboration. So working really closely with the hospital, other healthcare partners, addressing those underlying social determinants of health that sometimes you can't just pinpoint into one box. They affect so many different areas, and our department's very invested in looking at kind of those underlying issues and all the things that they touch on.
You bring up something, and that is just another great benefit of being in Vermont. We have the health department, we have the hospital, we have many independent medical practices, we have federal qualified health centers, we have many organizations that are devoted to things like food insecurity, which is what you brought up earlier, and we all collaborate and work together. There's always the desire to do that, and that just benefits the community. And unfortunately, that's not the case in many parts of the country, where it's a little bit territorial. There's a little bit of competition there, and I can just tell you, I very much enjoy practicing medicine here, and that is one of the major reasons.
I say it's one of my favorite parts of the job is how collaborative this community is.
Absolutely.
Yeah.
So tell us, I know you mentioned COVID, and the health department has a huge part and responsibility with COVID-19. What's been some of the bigger successes that you've seen so far?
Sure. So I think some of our biggest successes is the launching of the testing. It's hard to believe that last March and April, we were conducting our first facility-wide testing. These are new protocols. These were new activities for staff, kind of a new way of doing business. Our lives weren't the 7:45 to 4:30 anymore. This was kind of a all hands on deck around the clock. So integrating those new way of doing business, those new tier 1 priorities, as we call them, into our workforce and into kind of our way of of working was a big success. And then having people show up to the things we were doing. As healthcare people, you can put all the time in the world into a project, and sometimes people don't show up, but we've seen the interest in testing really ramp up. People know that it's a resource and that it has benefits for getting through this thing. So that's been a big success with testing.
That's great, and I can vouch that you've done an excellent job with it, and the community really appreciates that. All of these things had some bumps in the beginning, testing, vaccination, but through those collaborative efforts, we're getting there. So before we get in, I want to get into testing first, and then we'll get into some vaccination, and then we're going to get in by the end a little bit of why it's important to not forego healthcare right now. In fact, it's even more important to do so during this pandemic. But let me just start with a personal question so that the audience can know you a little bit. Tell us a little bit about yourself personally. You can what you like to do, what your hobbies are, and how you cope and relax with the current stress that many of us or all of us are under.
Absolutely. So I was looking forward to this question. So I was sharing with Trey that I came from New Orleans, and the last 12 years I have enjoyed the Mardi Gras season. This year it looks a little bit different in the city. It looks a lot different for me because we're not going down there this year. And so one of the projects I've really put a lot of time and energy to outside of work in the last couple of weeks was turning my home into a house float. It's a big project going on in the city. Instead of the big parades, people are turning their homes into house floats. And people can walk around and go look at all the beautiful art and kind of celebrate in a very socially distanced way, and still celebrate the carnival season. They put together a crew of expats, and I signed up. I'm on the official national map. And so right now my house looks like the Emerald City from Wizard of Oz. So I find a great de-stressor for me is crafting, building something, and then taking pictures of it and, looking at my creation.
That's great. I think you may start a trend here, and we'll have all the homes decorated here. Well, let's go into testing. I think any of the audience here is aware that although in the Northeast, the cases and the case rate, in other words, numbers of positive tests for the virus in comparison to population in New England has been going down steadily. It has been going down nationally, which is a great thing. And it's not attributed to changes in the virus. It's attributed to how society is behaving, as well as some other smaller variables. But unfortunately, Bennington County has not experienced that. Bennington County has had a steady increase. We believe we may have leveled off. But we do know that testing is incredibly important. If we test enough, we can catch people when they're positive, pull them out of society, help them recover, and then get them back into society without spreading the virus. Just tell me a little bit about testing in this area, in this region, and we can have a little conversation about that, because some of this testing is being done by the health department, some by other entities, and the hospital included.
Absolutely. So the new testing strategy, we moved, the health department actually backed away, and the SVHC stepped in with some other partners to launch 7-day-a-week testing at Bennington Rescue. I believe Tuesday through Sunday, it is all day. It's from, I have it in my notes here. It's an all-day event. Mondays actually a little bit later. I believe Tuesdays through Sundays, there's 144 appointment slots open every day.
Wow.
So yes, if there's always capacity, I would say. And so we don't want that to be a reason that people aren't getting tested is because they can't get a spot. There's lots of availability and every day of the week. Starting, I believe, this week, we'll see some testing opportunities in Manchester. So the National Guard will be hosting a testing site tomorrow, Thursday, at the Dana Thompson Center in Manchester. You can still register for the event, but they are allowing walk-ins. There's actually enough room to do about 200 walk-ins tomorrow.
Wow.
So if folks are struggling with the registration process or they just haven't had time, don't feel like you can't show up tomorrow. They will take you in. And I believe we'll have testing this Saturday, also beginning at the North Shire Medical Center as well. There's also news that there'll be some testing going on at our mountain communities and ski resorts. Those are kind of separate operations. I'm not really involved in those, but there has been some concern with our increasing cases and out-of-state visitors, and that some of the ski industry might be driving that. Well, in response to that, we're going to expand testing to those folks as well. We want to know everyone's status. And I think one of the things, and we talked about some of the successes earlier with testing, I think one of the struggles and challenges we faced with the testing is when people get that information and then they're kind of, some of the options, or there's barriers to being able to do the isolation, to do the quarantining. You know, you live with extended family, you have a job that, you know, doesn't have sick time or doesn't afford you the ability to take 7 days off while you wait, you know, access to food and things like that. I think, you know, on paper, it's, you know, we say just isolate for 7 days. And I think that, you know, one of the challenges we've run into is the testing is absolutely necessary to know and to be able to kind of take yourself out of the equation of transmission. But, you know, we do know that there's struggles in that too, for folks to be able to do that.
Absolutely. And, you know, unfortunately, probably many, if not most of the audience here has either experienced it within their immediate family or their extended family and close friends. And it's one thing to talk about quarantine, but then it's another thing to have to go through that process day after day with the family. So there's a lot of good resources that the health department, again, has online. And go ahead. Were you going to say some more about that?
Yeah, no, I would say those resources online, there's some great like one-pagers on strategies, even if you are in the same household with someone who's tested positive, the things you can do even within that space to maintain distance, separate bathrooms, different eating schedules, things like that. So really good suggestions for maintaining that.
So breaking it down, if someone wants to get tested, the ways they can do that are they can go to the SVHC website, which is svhealthcare.org, click on testing, which pops up right away, and it gives links to the state site to register for testing, as well as another location, which is the testing site at the hospital at SVMC. Right now, that's a phone call, but we will be moving within, we believe, 1 week, but I'm going to say 2 weeks, to also online registration for testing, which should streamline things tremendously. Unfortunately, it's two different types of registration. There's the state registration, and then there's the hospital. We couldn't blend them into one, but narrowing it down to two is almost as good. And it should be straightforward in registering for a test. The tests, you know, today run much more quickly than they used to. You can expect the results from both locations and within 48 hours, which is much better than some of the prolonged times we saw. At the hospital SVMC, we can get some of those results back on the same day, which we're really excited about. And of course, it's actually very important. You know, a test result 5 days from the time you get it doesn't help too much.
And we should know as the CIC, it is a self-observed nasal swab. Some folks may recall that at the beginning, we were doing still the brain tickler, which I think kept a lot of, you get it done once and then you're not really looking forward to doing it again. But it should be noted for anyone who hasn't been to one of our testing sites in a while, nasal swabs are at least the CIC sites.
That's exactly right. That's exactly
way
right.
less invasive.
Yeah, in fact, most places, including the hospital, are doing the more minimally invasive now that the testing is much better in that regard. So that, you know, that's testing, and it sounds like there's this changes frequently, and so we encourage people to look on the website and both the state websites and on the hospital website, because we do keep this information up to date. And we should be able to walk you through getting tested, because if you have symptoms or you have gathered or you have traveled, all the reasons that you know about, we want to make sure people can get tested and hopefully be negative, but if positive, that we can get them the resources they need. So we can now move, though, to the exciting aspect, which let's talk a little bit about vaccines, and then we can get into some of the questions. Vaccines are here, which is awesome.
Awesome.
They are available to, you know, it depends on your state. You may be listening to us from New York or Massachusetts or New Hampshire or another state, and there are some differences in how the states are rolling out the vaccine. We didn't have a concentrated, centralized federal response to this pandemic so far. It's been sort of state-driven. And so in Vermont, you can get vaccinated if you do meet qualifications as a healthcare worker, or if you are 75 or above, or if you reside in a skilled nursing facility. Those are really the three bigger groups. Mm-hmm. And for the 75 and above, fortunately, this is a one website reference. So you go to the state website and you enter where you are. So this is a little bit of a tricky thing, because if you don't enter where you are, it's only going to show you locations near you. But you can expand it by entering different other locations. And there's a testing site at Southern Vermont College that's operated by the hospital, SVMC. And as well as the health department. So talk about, you have a clinic going up at BBA, is that right? A vaccine clinic?
That's right. We're so excited to work with Burn Burton. They've been a great host, and it's been really great working with SVHC. We were really able to complement each other's plans, and that when we learned about hosting the site SVC, then the natural next move was, well, let's make sure we've got a location in the North Shire to really get that 30-minute, drive time geographic coverage for our communities. And so we were so excited to be like, well, we're out of here. Let's go to Manchester and set up shop there. So that's been a really great, collaboration, I think, between the two. The clinic runs from 9 a.m. to 3 p.m. It's appointment only. We really do stress that we're unable to take walk-ins, and serving 75-plus-year-old Vermonters. Folks can come in with a caretaker. And we've actually got a really good system there, probably similar to SVC. Folks with any kind of mobility issues can get dropped off if they've got a ride, and they can take the shortcut in to get in line. They don't have to walk all the way from the parking lot. Some folks with a little bit more mobility, they'll take the walk, but we do have that option.
That's great. And for the audience to know, if you haven't had a relative go through the process, or you haven't seen something on TV, at all of these sites, including at the college I just mentioned, at BBA, there's some other sites that are out there. The process is really fairly quick. You go in, you register, you're typically not waiting because of what Megan was saying about that registration process. And by the way, Vermont approached this with a centralized registration process. And I can't tell you as a physician and as a healthcare worker how nice that was, because it means that patients have one site they can go register, and it means we know exactly how many people are coming through, and we can do it fast and efficient. And that's the whole point, is to get as many people vaccinated as possible. So the whole process really takes about 30 minutes from pulling in, maybe slightly longer depending on the time of day. You just give them your name. You've already filled out everything. You go and sit in a chair. Within about 5 to 10 minutes, they call you. You get the vaccine. You're watched for 15 to 30 minutes, and then you're out the door feeling great and knowing that you have started the process towards vaccination for immunity for the virus. We do have some questions that are starting to roll in. So if I skip something, Megan, just jump in at any time.
Sure.
There's a lot of questions on eligibility, some questions on wanting to talk a little bit about what side effects there may be, and even the efficacy of the virus. So I'm just going to be reading some of these as they come in from Facebook, as well as, again, some came in a little bit prior. One is, does someone who takes care of a family member qualify to receive the vaccine as a healthcare worker?
Unfortunately not. If they're outside the age band, and they're not, I guess how we've been saying it, a healthcare professional, that unfortunately at this time would not be eligible. Such an important job. We absolutely recognize, all the folks caretaking for other people, but at this time, it's very limited to healthcare professionals and our 75-plus-year-olds, as long as residents in long-term care.
So this gives me the opportunity to just speak up real quick about why this was the right choice that the state did, and why so many places unfortunately didn't quite get it right. And anyone watching this who knows me was waiting for me to launch into this, because this is one of my favorite topics. But there would be no prioritization if we had plenty of vaccine. We wouldn't even be having these types of conversations. And unfortunately, we don't. But we knew we wouldn't. It's, unbelievably, it's only been about 60 days since the vaccine's been available and we've started vaccinating, and more supply is coming. There's been a lot of media attention to how poor the vaccine rollout occurred. I can tell you that in Vermont, that is not the case. Of course, it did start slow. If we'd had plenty of vaccine, we wouldn't be having these conversations, but we don't. We have a limited supply, and we know that there is one group of people that have the most deaths, the most hospitalizations, the most illness, and that is our elderly population. So we must start with them. We also know that healthcare workers do not have a choice. They have to take care of people that are sick right in front of them. And so that was the reason. Now, other groups have very compelling reasons why they need to be prioritized. And I agree 100% with almost every one of them that I have heard from and heard about. The problem is we just don't have enough vaccine. So if we did vaccinate other groups, what we would have to do is take that vaccine away from the elderly population. And that's not what we want to do. Down the road, as we get through the age bands, there is plans from the state to look at vaccinating people with certain high-risk health conditions, and that process will roll through. The good news is, too, vaccine production will increase. The amount of vaccine that we're receiving on a weekly basis in the state will increase. And there are additional vaccines that are coming forth, potentially one that everyone has probably heard about, the Johnson & Johnson vaccine. In maybe just a month, we may have the availability to give that vaccine. So now we have three choices: increased supply. The question of priority will become less and less important as we get that vaccine out.
Mm-hmm.
So the next question is, does the vaccine alter your RNA or DNA? Do you want to take a stab at that, Megan, and then I can chime in as well?
I would rather you take it. I think the answer is no,
one.
but I don't know if I'll be able to explain myself.
Yeah. So this actually is a question we get quite often. It is out on the intranet. It's sort of a fringe statement that's made. Was made early on, and the reason it's made is because the two vaccines that were first approved for use in the United States, the Pfizer and the Moderna, both use a type of technology where they use a piece of mRNA, which is sort of a code that is placed inside a lipid particle, injected into the bloodstream, and then that is taken up by the cells. And that code tells your cells how to make little particles, proteins that resemble proteins of the coronavirus. Then your body then sees those particles, those proteins, your immune system sees them, and then can recognize the virus should you ever come in contact with it. In fact, you will come in contact with it because the virus is becoming ubiquitous, and be ready to go. It does not alter your DNA. It does not alter your RNA in any shape or form. In fact, the body makes the proteins, then the mRNA is taken care of by your body, and there is no alteration of your DNA structure. Unfortunately, that has been out there a lot in the media as sort of a fringe theory, and it's not true. It is true that mRNA and DNA this is the first time they've been used in widespread vaccination. However, they've been used for over 10 years in other types of research and aspects of care. So we know that they are safe. We know that they work. And then the third vaccine coming out, the Johnson & Johnson, uses a different modality to distribute some DNA into the body. And then again, the body sees that, it makes a protein, and the next time that you come across a virus, it is ready to go. I did hear this great analogy, so I'm going to tell it. It's like, how do vaccines work? And the way they work, it's kind of like if you were walking around town and never seen anybody, the first time you saw them, you wouldn't have any idea who they were. But if you had a picture ahead of time, in other words, if you had a plan ahead of time, then the next time you walk down the street and you saw that person, you would know who they are. That's how these vaccines work. They get your body ready to recognize the virus so that when you do come across the virus, it jumps right in and makes the immune response, and you don't even know you had it. So that's super. All right. What about a question we're getting from Facebook says, wondering if vaccines decrease platelet count, and is it safe to have the vaccine if you have a low platelet count? So I'll answer this real quick and tell you, it turns out sometimes viral infections are associated with a decreased platelet count, but the vaccines themselves are not, and the vaccines are safe to be given if someone has a modest low platelet count. If someone had an extremely low platelet count, they need to be monitored very closely, potentially even in a inpatient setting in the hospital, and may not be recommended to get the vaccine while that platelet count is extremely low. But if it's moderately low, which we see a lot of people have low platelet counts in various disease states, and it is okay to get the vaccine. Let's see, Megan, another question from Facebook is, what are the state rules for overnight travelers regarding quarantine if they've been vaccinated? This is something that comes up all the time.
This is a popular one. Our travel restrictions have not changed, regardless if you are vaccinated or not. If you are traveling from out of state to Vermont, you would still have to do the 14-day quarantine with the test out option at day 7. Same goes if you are not vaccinated at this point. So no change from how we've been operating,
Right.
which is unfortunate. I think everyone's waiting for that, but we're all still playing by the same rules.
That's right. And I think the governor and the health commissioner did a great job of answering this question last week in the press conference. And basically, let me paraphrase what they said, maybe even put forth some more optimistic view. It's coming. There's coming a time when the vaccination will allow you to travel, to gather and not quarantine. But at this moment, there are too few people that would be vaccinated. And so you have to have many people around you vaccinated in order for the vaccine to have its full effect. So let's get through a lot of these age bands, and then we can talk about, all right, now can we travel without having to quarantine? And the other point that the governor said and that the health commissioner said, which I think is wonderful, let's get guidance from a federal level so that the states don't vary in their recommendations. So New York doesn't vary from Vermont, from Massachusetts, New Hampshire. Let's have the same guidelines to follow, the same restrictions, and I think that makes a lot of sense, because I can tell you, being in a health system on the border here, we have to understand New York, we have to understand Massachusetts, Vermont. They have some different rules, and that makes it difficult and confusing.
And I can only imagine how much staff time is spent, people calling, what's your rules there? Just freeze up, people. We all have the same.
Absolutely. So another question is, would you recommend for or against an entire family getting vaccinated at the same time? For example, 3 people over 75.
That's a great question. I think I would recommend you get the vaccine as soon as possible, as soon as you can get the appointment within the same household. I'm not sure staggering would be beneficial. I think as soon as possible. Yeah.
And that's what I agree completely, and that's what we say too. I think it is important to be transparent and say the younger population does have a higher rate of having a short-term fever or muscle aches a day after the vaccine, particularly a day after the second shot of the vaccine. And that is normal. That occurs with other vaccinations. It's a little bit higher with this COVID-19 vaccine, and it shows that your body is mounting an immune response. And so, you may even miss work for a half day or a day if you have a fever and don't feel well. A vast majority of the individuals that have this type of side effect over the next day are younger. Typically younger than 50, not always, but typically younger than 50, and they almost always are ready to go the day following. I will say, for transparency, I've never had a problem with any type of vaccine. I got the COVID-19 vaccine. The next morning I did have a fever. It went away after a couple of hours and I felt great. So that just showed me that the vaccine was working and that my body was working, and recognized it.
Yeah. I think too, one of the questions we've gotten a handful of times is, will people test positive for COVID after they've had the vaccine? And the answer, if you have a PCR test, you not test positive for COVID. The PCR test is looking for a viral infection, and that wouldn't come from the vaccine. If you used an antibody test, it could show up as positive, because that's what the vaccine is pushing your body to do, to make antibodies. So we have had that question a few times. So if following a vaccine, you are continuing to feel crummy for longer than 24, 48 hours, we would recommend maybe seeking a COVID test if it felt right.
That's right. You can still get the disease. Nothing is 100%, but particularly if you got vaccinated, around the time before your body made its full response yet, it is possible. I think that the people do know that it's been publicized of legislators or other famous people having full vaccination and testing positive for the virus later, please know that so far, I was going to say a majority, but no one has been reported to actually have the disease, COVID-19. They may test positive. It just means they came across it. The vaccines themselves, unbelievable. We can talk about 75% efficacy with Johnson & Johnson and 95% efficacy with the Moderna and Pfizer, but really they were all 100% efficacious in preventing death and hospitalizations. And that is the thing that we really, if I get ill with the flu every, several years. And that's the same thing with COVID-19. But if I can stay out of the hospital and of course prevent death, then the vaccines are working tremendously well in that regard.
That's a success.
Well, we are out of time. I want to thank everyone for joining us today. We could probably do 10 of these shows because there's so much information on vaccines, so many great questions. Our ability to vaccinate and our knowledge on the disease itself continues to evolve. So we'll probably do another episode with this topic. I'd like to thank our guest, Megan Harrington from the Vermont Department of Health, the Bennington District, as well as Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowett, also from Southwestern Vermont Healthcare. I'm Trey Dobson. Let me just tell you something. You are awesome. Go out and find joy in everything you do, even in the face of adversity, and we will see you next week.
Great. Thank you.